It's Speaking with Gravity. On this podcast, we talk about mental health and how everything affects everything. With every episode, the goal is to have a conversation that will make you think, make you feel, make you do what is best for you. This isn't therapy, it's a podcast.
Welcome back, y'all. It's Speaking with Gravity once again. I'm your host, Joshua.
This is Hannah.
I'm Dee.
I'm Curvin.
And we are the Speaking with Gravity podcast. We're back for another great episode, y'all. And we're actually, we're back in May. It's Mental Health Awareness Month. Mental Health Awareness Month. So definitely want to get into talking about therapy today and unpopular opinions and biases around therapy. You know, we got a lot of people talking about therapy, y'all. And a lot of people think they know what they're talking about, but not practicing it, not going to see the therapist. So we want to today really bring to your attention the importance of therapy and the truth and the facts around therapy is what we want to do. So we have a special guest today, actually. We have Ms. Hannah Williams here with us today. I want you to introduce yourself for us, Hannah.
Yeah, so I am currently a graduate student. I'm studying at Winston-Salem State University, which is a small HBCU, in North Carolina. Currently on my senior year, my last year of my graduate program, and I am studying clinical mental health. So I'm just excited to be here, more so excited to help the community and to spread mental health awareness with this Mental Health Awareness Month.
Most definitely. And I know you're youthful. You know, we can all tell that. Just wondering, you know, what brings you to this career? You know, at a young age. I love seeing young people in careers where they can kind of give back and whatnot. So, what brings you to this?
I would more so say I was placed in this career. It wasn't even my choice, but I have seen on a personal level how mental health has impacted people close to me. It has impacted a community. And I think it's just our job as a community to come together and to spread awareness. And it starts one person at a time. So I just feel like this career was God-given, if I can say that. That's a blessing.
Well, I love it. Well, we're grateful to have you in this space. Here. Yeah, in this space with us and in this career. If we haven't mentioned it already, everybody up here is in mental health except for me. So you can definitely trust any strategies and all that they give you. What I say, I don't know what you can do with it, but just listen, I guess. We want to start out with our Twitter discussion today. It comes from one of our very own, actually, the Twitter discussion. So we'll let him deliver on that for us.
All right. I definitely feel the need to counter this thought process. Therapy, much like real life and real-time mistakes, is not a waste of time when the process includes an open mind and a willingness to learn. And that was a quote, a retweet, I guess, of, and I guess I might have to play it on here if y'all haven't seen it. Steven Jackson came on and said that Ja Morant didn't need counseling. So the backstory with Ja Morant was he's done some stuff that was questionable, to say the least. So he put on Instagram, what led it off was he put on Instagram, he was at a strip club, you know, vibing to the spot that he was in, and then he showed a gun. So that's a no-no. He's a brand. The NBA is a brand. He's a part of that. And so that's a no-no. But then it starts coming out other things that was happening, him getting into fights, him having verbal altercations with people, or his family having altercations with people and bringing him into it. Then they started talking about the type of friends that he's had, and even the altercations he's got in on court. Stemming off the court, going all the way off the court. And so, long story short, once he got involved in all of that, he released a statement saying that he apologized, he was aware of his actions, and he was going to get help for it. So he I've heard that he went to Florida and checked himself into some type of counseling agency, something. He did something with counseling. And then I even heard something about 20 sessions. Now, I don't know how he was able to get 20 sessions I think he was gone like 3 weeks. Mm-hmm. I don't know how he was able to get 20 sessions in 3 weeks unless he did them every single day. But Steven Jackson came, and did y'all hear?
I didn't see it.
All right, I'm gonna play that just so that we can kind of dialogue about it. I don't know if you have to cut this out, Winston, or not, because I don't know how it goes with the algorithms. But I'm gonna play it.
Check this out. I hate the fact that they made Ja feel like he needed to go talk to somebody or talk to somebody how to deal with his stress or ups and downs, right? When we got into the brawl and when I got into the show, they tried to make me talk to somebody. Now, the lady was cool. The lady was super cool. But I didn't talk to her about my problems. I damn sure done confided her and say nothing about what I had going on. Nothing. Man, ain't nothing wrong with you, bro. You made a bad decision. You fucked up. Deal with it. But you don't need to talk to nobody, bro. Because whoever you talk to ain't going to relate to what you got going on. They just somebody that's sitting there that's going to give you an opinion about what they think you did. They ain't got no experience. Ain't nothing wrong with you, Ja. Just get back to playing basketball, dog. Fuck everybody.
Oh.
Check this out.
How y'all feel about that?
That is interesting.
Well, you coming from my profession, so that's the first thing I feel about it. But even in the way that he shared it, right? He said she was cool, but I didn't tell her anything. So if you don't give me anything, no, I ain't gonna be able to help you. The other thing was he shared it seemed as if he was saying she was giving her opinion on something. It's not opinion. This is evidence-based. It's research that we're giving you based on what you present to us. And then there again, I think on the last episode, I talk about recognizing patterns and being able to share with you the patterns that you may not see. You know, I think sometimes we forget we live this life. And when you're living life, you don't always remember how things connect. You remember the incident, you remember the situation, but you don't always look at the patterns until you start speaking it, talking it out loud, or you give it to somebody and they give it back like, hey man, you remember this and this? I remember having a conversation with one of my friends, and this was not therapy, but I had a conversation with him. Every so often he would come to me and talk about a breakup he had. And every breakup he had, when I have breakups or when I've had breakups, they've been that, a breakup. I didn't have nobody key my car. I ain't have nobody slash my tires. I said, hey, man, what type of people you dealing with? And it was like a light bulb went off. Now, he's living that life, and it's been 3 or 4 or 5 people at that time, but he still couldn't connect. I'm dealing with the same type of individuals until that statement was given to him, and then it was like, oh. And literally, you could see him change the way that he started talking to individuals and connecting with individuals. So I definitely didn't like it. The biggest part was I didn't give her anything. She was nice, she was cool, I didn't give her anything. But if you don't give me anything, I can't give you anything.
So. Anything stand out about that to you, Hannah?
Yeah, I think that's very interesting. And this can be an example of how a lot of black men feel about therapy and going to therapy in our community. I know each situation is different, but in this situation, one thing he said was also just piggybacking off of you, how he said he didn't give anything, but also in that situation, we have to think about, was his therapist assigned to him, or did he pick this therapist? You know, with the NBA and everything, maybe they have a therapist that was assigned to this person, and maybe it didn't fit his cultural background. Maybe he didn't trust his therapist to give, you know, to open up about the problems that he was facing. So I think we have to, you know, analyze that. You know, if your therapist isn't someone that you can trust, of course you're not going to open up, and then in the long run, it's going to be a waste of time.
Yeah, that affects it a lot. You feel any way about that, 2D?
I think they've highlighted both of the main key concepts that I have pertaining to that video.
Pretty much hit them on the head.
And we do, it might not be a lot, but we do have African American therapists out there, psychologists, psychiatrists. They are out there, and you can find them. They not hiding. They're not running from you. They can be found. You can go on. Of course, Psychology Today was probably the biggest one. But outside of that, there is therapy for black girls.
Yeah.
And
They
then
also have
there's
one therapy for black men.
Yep. And they've got a couple of more that they won't come to my mind right off. There's Therapy Tribe. These are directories of psychologists and therapists that you can find. And if nothing else, people always listen to these different podcasts and stuff. Reach out to the different podcasts because if they're in that field, they know how to get you to the people that look like you. So.
And can I also add, relating to the tweet, therapy is not a waste of time when the process includes an open mind and willingness to learn. Everything starts with an open mind. If you're forced to go to therapy, you may not have that open mind. You may not have that willingness, similar to the John Morant situation. But if you voluntarily sign up for therapy, this is something that you have signed up for individually, so you have to be a part of the process.
I totally agree. Our QD of the hour. You want to get that to us, D?
Okay, so according to the American Psychiatric Association, better known as APA, about 75% or 3/4 of people who try talk therapy notice its benefit.
Hey, D, what is talk therapy?
So talk therapy is basically therapy that is conversation. It's conversational therapy where there is an exchange of information from an individual to a professional. So just basic dialogue is what talk therapy entails.
A traditional form of therapy. That people, I guess, what people think about.
It's also known as psychotherapy.
What are some of the reasons that y'all have heard that people won't go to therapy or that people feel like therapy isn't for me?
I'm gonna start off with. I think sometimes people don't feel as if therapy is accessible. They look at the cost. Again, going back to what we were talking about with cultural differences, they assume that there's nobody that look like them that's available to them in their particular area. But it is accessible. Most insurances do pay for it. So you don't have to necessarily.
I didn't even know that.
That changed a few years back, but yeah, most insurances
That's
do.
dope.
Most, but you still gotta call your insurance company and see, hey, do y'all provide mental health services?
Okay.
If they did not, for whatever reason, then you just reach out to a therapist. Man, the amount or the fee is so wide ranging, right? It could be up to $200-$300. If you're going to a person who deems himself a specialist.
That's without insurance too.
Without insurance, or it could be. I've seen it as low as $60-something. Now, it might be lower than actually $30 if you go through. There's a directory called Open Path Collective. And the minimum amount that a therapist will accept on that one is $30. Now, I don't know who doing that personally, but that's their minimum amount, and you probably somebody on there doing it. All right. That being said, that makes it from a monetary standpoint that cuts out. It's not accessible. $30. It's a lot. You get I ain't gonna go there.
They might just hand you a book and that's it. $30.
I don't know. But it's accessible from a money standpoint. And then when we're talking about wherever you stay at, we have telehealth now. So you don't have to go into a building or a room with a therapist. You can do it right there online. It just depends on their therapist. So
And you can always look at reviews too on therapists as well, right?
Yeah.
So somebody that's got it for $30, they might actually be giving really good service.
Yes.
I was joking about the book, about getting a book for $30.
And when you go to these directories that we've mentioned, it's kind of set up like any other, like a social media. They have a profile. They're gonna have their picture on there. They're gonna have whatever they believe in, how they deliver therapy services. They might even have a video that you can watch to kind of get a feel for that person.
I want to talk a little bit about the accessibility of therapy. I know that one taboo about therapy is that virtual therapy may not be as effective as in-person therapy. And I also thought the same thing, and I know I've spoken with a lot of people around me that think that virtual therapy, you just won't get the same effect as being in person. But that goes back to how we talked about everything starts with an open mind. If you're already going in saying, oh, this is not going to work, it probably won't work. But if you're going in with an open mind, thinking like, okay, let's try it out, you won't know how effective it is until you try. You can always change. I think that's one thing we have to normalize. If one therapist isn't working for you, you can go to another therapist. You can find another therapist, similar to doctors. If one doctor isn't, meeting your needs, you can find another doctor. So it's an open world out here.
Yeah, kind of like getting a second opinion almost. So, yeah. But yeah, D, anything sticks out for you? No. I wanted to ask about.
I did want to add one more thing.
Please.
What was the original question you said? Some of the
things that come to mind when you think of or some of the things that you hear people saying as reasons that they won't go to therapy.
Yeah, one that I've heard often is that, why would I go to a therapist when a therapist needs a therapist? And that's been normalized in our Black community. Why would I share my problems to somebody else that has their own problems? And that is true. But a lot of therapists do have therapists. We're all humans. We all face problems, challenges in life. So I just wanted to normalize that therapists are humans as well. So yeah.
I'm gonna tell you the truth. Before I was really introduced to therapy, I felt like therapy was almost like getting in my head, right? So for somebody out there who may feel like that, they may be apprehensive for that reason. What can you all speak to that? Can you speak to that?
What do you mean getting in your head?
So like
Getting
almost
into your
convincing me.
personal
No, like almost convincing me that something is wrong with me.
Okay.
I feel like people in the general public probably have that same fear. Can you speak to that, D?
I think the concept of people, kind of changing. So let me back up. The concept of what I'm hearing you say is like get into my head as if like something, like you said, something is wrong with your existing train of thought, and so someone's trying to force you to think a certain way that is not original to your own personal interests or desires. Is that what I'm hearing you say?
Yeah, and also maybe even bringing up something from my past and shaping it in a way that makes me feel as though, nah, that's not, that's not what it is really. It may be, but I may feel a little protective about that.
I think the ultimate fear of a lot of people as to why they don't go to therapy is because people don't like the idea of someone potentially judging them. And so anytime you see therapy as a judgment, it often is going to prevent people from seeking it instead of people seeing it as an aid, right? So like if I'm bleeding, people don't have an issue getting me a Band-Aid, right? But if I am in a emotional or mental state that is changing the way in which I'm able to function day to day, most people don't recommend me going to talk to a therapist, right? That's abnormal. But the goal of it is to kind of create a seamless experience. Is that I think what Hannah said is important. We are all human. And so when we are going through different experiences, we all need support to some level. You know what I'm saying? And identifying what your level of support may be is going to be critical to how you grow and how you evolve. I think what Hannah said earlier was having an open mind about what it is that you're needing and what it is that you're desiring. You have to be at a place of where you recognize that what I'm doing, the current way that I think about things or the current way that I respond to things isn't helpful to me. And you know what? You have to really kind of get into a space of, I'm not coming here to be judged, or I'm not coming here to play, but I'm coming to lay stuff out on the line. You know what I'm saying? To be able to be true about who and what it is that I'm feeling. I think sometimes why people avoid therapy is also because sometimes therapy does make people deal with some things and emotions that make them uncomfortable. And most times people don't like becoming uncomfortable, right? People don't like having to really deal with some things, like you said, that they've kind of either felt like they've suppressed or kind of put out their own mind. So if I start bringing this up, then she gonna make me start talking about some things that happened to me, X, Y, and Z, and you know what I'm saying? And people don't want to deal with that icky feeling that they think that sometimes therapy creates, which in essence it can create that, but sometimes it doesn't always create that experience. So just kind of different from every person.
I almost feel like it's also like a fear that the therapist is going to take that and almost like diagnose me with something that I feel like I don't need to be diagnosed with. Like that ain't, that's not really me,
So I want to clear up diagnoses, because I think sometimes people take on labels that don't necessarily belong to them. And I'm having this conversation more frequently. Me, myself, in practicing, I don't like to diagnose anyone, because when we are meeting with people, we're taking a small clip of who you are. If you're 25, if you're 18, if you're 40, I'm only meeting you in this small window of your life. That 1 hour that you're interacting with me does not attest to everything that you've exposed. When someone gives you a diagnosis, it is, if we want to be technical, it's about billing purposes, right? That is on the premises of billing, because insurance, that's what that is. It is money oriented. Now, does that mean that a diagnosis is not real? No. A diagnosis can be real, but sometimes people are diagnosed with major depressive disorder when actually they're just experiencing a depressive episode, which means it's not something that's reoccurring from them. It's just something that they're experiencing at that level. But if my mentality and my lack of understanding is that this is a permanent state, now every situation that I experience, I'm thinking of it from a depressive standpoint, right? And so you have to be very intentional about your therapist. And so I've had people say to me, don't put that diagnosis on me, or don't do this. And I'm like, look, this doesn't define who you are. It does not make you depressive, or it does not make you, schizophrenic, or all of these things. These are general characteristics. And if, generally why we encourage people who are not therapists not to get caught up in diagnoses, because that can be very dangerous for a lot of people. You know what I'm saying? Because they start taking on identities and characteristics that really don't belong to who they are, but their thought of processing becomes that identity, if that makes sense. Maybe went off a little far. So
no, you definitely did not go off. You hit the nail. But I also want to say too, when you start taking on what you just said, you start taking on a diagnosis, it's almost as if you can allow yourself the space to have excuses. Right. Oh, I'm depressed, and this is why I'm doing this, which could be true, but it also could be you making an excuse for it. Or I'm bipolar, or you do something to somebody, I'm bipolar. You're in therapy to address those things so that you don't have to continually disrespect people or engage people in a way that they don't want to be engaged. You're emotionally, you're going to build your emotional intelligence. Right? You're going to become more aware of how you affect other people. Go ahead, Anna.
Yeah, and also I agree with everything that has been said. And then also just from a cultural standpoint, for so many generations, we didn't have those labels. Someone is schizophrenic. We might have said, oh, they acting funny, they talking to themselves. Yeah. But now that we have these labels, I'm not a fan of, labeling a person. However, now that we have those labels, now we're able to get the proper support that we need. So if someone is depressed, okay, I might be experiencing depressive symptoms. I need to do A, B, and C. Okay, I might be bipolar. Now I need to do A, B, and C. But without those labels, we're not able to provide the proper support for their specific situation. So, I just wanted to add that to the table.
And going back to the billing and labeling and stuff like that, you do. So the insurance company, you're paying them, and then they're paying the therapist. The insurance company don't want the therapist to see you for the remainder of your life once a week. They want a label, and they want to say, all right, this is how you're addressing this, and it's going, because you're addressing it this way, we're eventually not going to have therapy. That's in general the concept. So it's kind of like if you go to the hospital, you got a broke arm, you don't expect to go to the doctor for that broke arm for the rest of your life. He's going to do certain interventions, certain techniques, certain surgeries that's going to fix it so you don't have to come back to him. And the insurance is going to pay him that set amount to do that so that you don't have to come back to him. And ultimately, that's why that person, if your insurance is paying for it, they have to give you a diagnosis so that the therapist himself or herself can get paid. Now, if you're paying out of pocket, the therapist may even say, and I have done it, I'm not going to give you a diagnosis. We're going to come in and we're going to deal with what you want to deal with because you're paying me. I don't have to answer to nobody but you. And going back to what Hannah said, you can fire your therapist at any time. At any time they not suiting you, or as y'all have reached whatever y'all going to reach, you don't have to go back to that person no more. You lead that.
And I think it's important to note, too, that a lot of times when we're talking about diagnoses and things of that nature, we are oftentimes required to assign that within 1 or 2 sessions. Well, typically in your first or second sessions, I'm building rapport with you, right? And so I don't have all the information that I need to make an accurate diagnosis if we want to be real. But what I do is try to take what you said. And so if you've highlighted mostly the negative things, I'm okay now this person is really that, you know. So that's why diagnoses are not always permanent as well, you know what I'm saying? Because I could be thinking it's one thing, not realizing, okay, you've had, you know, several deaths in the last 2 years, you know, you just may have had a miscarriage. And so these life events that have occurred for you, you know what, are appropriate for what you have experienced, and therefore it's not necessarily a meaning that you're depressed. It's just that maybe you haven't been able to really recognize or address everything that you've experienced, and you've just been trying to keep going and going. And so as a result of that, it's put you in the position of thinking or feelings that you are experiencing at that present time. However, just us being able to have conversation, you being able to process some of that, could really change your whole perspective. And so again, that's the difference between having depressive episodes versus being severely depressed. And I think sometimes, like Kervin said, I don't think it's always that people want to use it as an excuse, but I think people want to be able to give some reason or justification for what it is that they are experiencing. But the thing that I really have come to understand is that life is happening to all of us, right? There's no way of escaping it. And even myself as a professional, if I pick up that DSM-5, there are a lot of diagnoses. It's the DSM-5.
Okay, y'all know
it's the
they don't need
diagnostic manual that we use that entails all of the different diagnoses and conditions that people can be associated with mental health. And
is that a big book?
Yes, it is. It's very big.
Full of details.
It's full of details specific to characteristics, but some of those characteristics are very generalized, right? And if you are in the professional field, we know that, you know, there are certain situations that time frames changes diagnoses, right? Certain characteristics changes diagnoses. But if you're just looking at it and you don't have the intellectual knowledge or the pre-existing knowledge of it, you could really pick that book up and you would think you have everything from the beginning to the end, right? And so this is where that educational component is important. And this is why there's a difference between sitting with a professional versus just having a conversation. It's not that we discredit anyone, but there are certain things that, you know, you're taking on a label that doesn't belong to you. That doesn't benefit you. You know what I'm saying? When you generalize something as just generalized anxiety disorder versus feelings of anxiousness, right? Those are two different things that are very common and they are easily misconstrued, right? And so this is sometimes why people get on medication and other regimens that don't work for them. That's the other thing why sometimes people don't go to therapy, because they feel like they just gonna be medicated. You know what I'm saying? And so this is why I think we, like she said, have to address certain things within our culture specifically, because we have to break down these myths and misconceptions of what it is, which is why podcasts like this and conversations are so important, because what we're doing is trying to break it down to that general language, because until you do something different, we don't get a different outcome, right? And so that's kind of what I
just want to add, if the diagnoses and the labels is something that's preventing you or hindering you from seeking therapy, have that conversation with your therapist. That's what us, well, I'm a future therapist, but that's what us therapists are here for. You should be able to trust your therapist to have these type of conversations, with them.
And the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders. And when she say 5, she's saying it's the fifth edition. Yeah. So, and with these editions, they sometimes take away things, sometimes they add things, sometimes they further explain it, so that we can have a better understanding before we actually slap a label or put a label on an individual.
Like, I can just give an example. I know, like, if you're experiencing depression, if a client, say, I'll use you for an example. If you come to Garvey and say, okay, I'm depressed, he may ask you, according to the DSM-5, well, how long have you been experiencing depression? If you've only been experiencing these symptoms for 2 weeks, that's a little, are you really depressed? But if you have been experiencing these symptoms for maybe 2 months, 6 months, then he can use the DSM-5 to connect with what you're coming into office saying, okay, I'm experiencing this, this, and this, to connect that to a diagnosis. So, like they were saying, we don't misdiagnose a person, which is pretty common in the Black community.
Right.
So the misconceptions, all of those are very valid, but that's why we have this manual to go off of, so that we don't misdiagnose.
And I think bringing it back to what you just said, I'm glad that you brought that up, misdiagnoses. But a lot of times misdiagnoses occur just because of what he said in that video. I didn't tell her anything, right? So I gave her the bare minimum. And because you give the bare minimum, if that bare minimum aligns with the diagnosis, it's easier for it to be attached to you. And so, again, that's where the breakdown gets, because now I'm giving interventions that are based specifically on this, right? When this is not really what you're dealing with. And so, we don't want to talk about it. And I've had this happen before, where people will be seeing me for, 2 months before they say, I've been using this substance, or I've been doing these other things. And it's like, well, wait a minute now. We didn't add this in there because that filters out, okay, was this you? I've been seeing things or hearing things. Now, I'm thinking you over here, but really you've been using a substance that create these experiences, right, and these effects. And so that, again, alters the treatment and the intervention that we can implement during those times. And so I think we have to break those cycles of, what we've always heard, what goes on in this house stays in this house. You don't talk to people about your problems, you figure it out on your own. No, sometimes we do have to talk to people and talk to the right people so that we can get the right level of help and support.
Chris Rock came in maybe a year or two ago on the Breakfast Club, and he said one of his revelations was he had to be honest in therapy.
I was just about to say that. Yeah.
He had been going to therapy off and on, and then when it really started working for him is when he was honest. But I tell people all the time, if you tell me a lie, I'm gonna give you a response to that lie. I don't know that it's a lie until you tell me it's a lie. But I'm gonna give you an intervention, or I'm gonna try to work on some skills to address that lie. If you gave me a lie, no, therapy ain't gonna work, because I'm addressing what you gave me, and it is not really applicable to you. In that particular situation. So, just go in and be honest.
So it's important to put in what you want out.
Mm-hmm. Yeah, absolutely.
I think just from what both of you all were saying, I heard that the core value here is honesty, being authentic. And that can be hard, when you're signing up with a therapist that you've never had a conversation with before. You don't know them in the past. One thing that I would suggest is to have like a consultation with your therapist before you start that first session, just to see, is this someone that I can build a relationship with? A professional relationship with? Is this someone to be honest with.
I remember in grad school, to your point, one of our assignments, and this is the first time I had did it, was to go to a therapist. And I went for the first time, man, it was so uncomfortable to me. Now, it hasn't been uncomfortable since then.
What was uncomfortable about it?
Being in front of a person, sharing whatever, in that particular situation.
Responding to those questions?
Responding to the questions. Now, some people, people are different. Okay. Some people will come in and they're going to give you what they're going to give you. And then other people, you kind of got to ask stuff. And when I was, my very first time that I was in there, that I did therapy, the person had to just kind of ask me in order for that conversation to go. Now, since that time, I have been able to go in and just talk about whatever I'm going to talk about. And I'm pretty sure the therapist is probably happy.
You've been intentional with it now, but in the beginning, you kind of had to do it. So it wasn't,
had to do it. Didn't know what I was doing. Didn't know what I wanted to talk about, and that person asking me questions.
And vulnerability is hard.
Yeah.
You know, it's hard to express that your past traumas. It's hard to express the problems you're currently dealing with to someone else. That is difficult to do. But go ahead. Yeah, I was just gonna say it's difficult to do, but that can be the exact thing that's stopping you from becoming a better person, from growing.
Absolutely. Yep.
You could be your biggest enemy.
Definitely.
And I think, too, part of the other myth for why people don't go to therapy, and it may be used, I think, as Kirby said earlier, as an excuse, is that the therapist doesn't look like me. I want to break the myth of that a person has to mirror you or have the same ethical background as you to connect to you, because people can look like you and still not connect to you. And so, being open-minded to who you're going to see, and having questions when you go into this, like, what is your your familiarity with working with individuals from my background. You can ask these questions, because I tell people all the time, it's nothing different than like you're going on an interview. While you're hoping to obtain the job, you should be interviewing the person that or the agency that you're applying for as well, right? So while you're going to see a therapist, you should be interviewing that therapist. Because yes, I can put that I specialize in this, but sometimes people do a training for 6 months and now that makes them a specialist, right?
Or 6 hours.
And so you have to be intentional about, what I'm saying, does this actually fit what I need in this era? And you know what, let's be honest, all therapists ain't meant for everybody. And I will tell a person, based off of what you need and where you are, I'm not the therapist for you. My approach to a lot of situations sometimes is direct. I'm not a beat around the bush. I'm a straight shooter. But some people, that doesn't work for them, right? They need someone that can go a little slower with them. You know what I'm saying? And so it isn't that I can't help you, but the way in which I provide therapy would not be beneficial for you, right? And so you coming to me for 3 months, you probably just gonna be like, oh, I ain't going back to her. You know what I'm saying? So let me guide you to somebody that can aid you. And that's okay. That doesn't mean there's something more wrong with you. And that doesn't mean I'm not good at what I do. It just means that I'm not the right fit for you. And I think that's what we have to normalize, is that we do have to ask questions. We do have to do things. One of the things that I saw from our community working in a doctor's office is sometimes we just accept anything people say. We don't ask questions about nothing. They just tell us to do something, take something. This is how I'm supposed to feel, and that's it. You
talking about black folks?
Yes,
okay.
Our people.
You wanted to make that clear, huh?
Yeah, our people.
Well, I thought you were saying people in the doctor's office. I don't know.
When I worked in the doctor's office. So back that up if I created that misconfusion or that confusion. I'm sorry.
It's probably me.
No, it's probably me, because sometimes my mind, I tell people that all the time, you got to stick with me because I'll be going somewhere, but take me some time to get there. But working in that setting, oftentimes I've seen from our people, African American people or people of color, Ty ain't here to correct me, but just how often we just accept anything that people tell us, right? And we look for people to have an answer instead of realizing that answer sometimes originates from us. In therapy, the answers that you have to help you solve your problem in true honesty is going to come from you, right? Because while I'm using certain techniques and certain approaches and certain interventions, the true gift and the true solution of that is going to come from you practicing that and putting it into work and figuring out how it works best for you. And so a lot of times people are afraid of realizing that the answer that they have has been with them the entire time. They just haven't been willing to open themselves up to use it.
You got to put in the work.
Yeah.
I think that's another unpopular opinion about therapy is that it requires work. It's not easy, and not everyone is ready to put in that work. I can speak from a personal standpoint. I started therapy years ago, and then like Kervin was saying, once I started my graduate program, it was kind of encouraged for us to go to therapy so we could resolve our past traumas and our, general issues that we're dealing with in life before we're able to help other people. So, you have to put in the work. It's not easy. You have to put in the work. You have to be ready to put in the work.
So, sound like you all are therapists or are becoming therapists that have gone to therapy. Winston texted me a really good question. He asked, as a therapist that has gone to therapy, did you ever or do you find yourself anticipating things that they'll ask you?
In my situation, no. I preface that with when I'm going to therapy, right? I'm going to somebody to deal with a situation. They're gonna be more like what Dee said. They're not gonna just. It's not cookie cutter. I hope I'm not being disrespectful to anybody, but it's not cookie cutter. It's not by the book. They're gonna come at me. They're gonna come at me raw. So I don't know where they're coming. I don't know what they're doing. And even though by the end result, will I see where they have, how they came to that? Yes, because I'm a therapist. But no, they're probably pretty darn good. And so, no, I can't see what's coming.
Gotcha.
Somebody, and with all due respect to Miss Hannah, I may be able to see her because she's just coming out of school. And if I go to her, I might be able to see where she's going because she's learning throughout that process. And she's dealing with somebody who's done it for a couple of years.
Yeah.
All right. That's not to say that once she come out of school, nobody should go to her because she is going to be ahead of a lot of people in general. But for a therapist who's done it for a good while, I might see what she's doing. But then that's also probably why I wouldn't necessarily go to her at first. Right now, I'm not going to go to anybody that just graduated. That's just me. Not saying there's nothing wrong with it.
Yeah.
But that's my answer to your question. I hope Dee don't jump on me too bad about that.
No, I think my answer to that is that knowing my own self and knowing my personality, am very intentional and selective about who I use for that level of support. And I think that's where, as a therapist, I use those therapeutic skills of, is this person going to be intimidated by what I do? Oftentimes, when I go to see a therapist, I don't tell the person that that's something that I engage in, right? Because I want to see their skill set from this. And if I say something, I want to see if they're willing to explore that with me or if they make note of that, because that lets me know from my experience whether they can handle maybe the level of conflict that I am presenting with at that time. And that's something that being in the profession allows me to do. And so it doesn't discredit someone because they don't have as much experience or give credit to someone because they do. Because just because a person's been a therapist for 20 years doesn't make them a good therapist, right? And so it just, again, is really about me finding someone that matches me. And that's why it's important to have conversations about what it is that you're dealing with, what it is that you're looking for, because if I'm a really good therapist, I will tell you that that's not my area of expertise or that your level of need exceeds what I'm able to provide right now, and then direct you to someone who can aid you. It can be very challenging being a therapist and being in therapy because you find yourself wanting to challenge a lot of things, just as you would in any profession, right? Because we still got mess too, and it's
I don't know. I
sometimes.
think you just a challenger though.
Yeah, by nature. But sometimes it's hard to realize you got mess on your shoe too. You know what I'm saying? It's hard to come to terms with that. But that's why I respect the profession, because sometimes you're walking around with an odor that you don't recognize, right? And you don't know where it originated from, but it's because you done stepped in some dew. You know what I'm saying?
Yeah.
And until someone brings it to your attention, you don't realize it. You know what I'm saying? And you're walking around and people are saying things about you. People are talking about you. People are smelling your mess. And you're not able to change it because you don't know that it's there yet. You know what I'm saying? And so you thinking it's everybody else. And the truth of the matter is it's really you. And that's why, again, therapy, even as a therapist, is important, because sometimes I need help seeing my mess.
Now I don't do what I tell you I'm a therapist when I get in. I need you to know, so you coming at me as strong as you can come at me, because you only got one chance. You only got one chance with me. You only got one chance, and then I'm on to the next one.
I got you. I want to ask a quick question to y'all, being that it's Mental Health Awareness Month. Well, it's a two-part question. First, is mental health awareness in the public school system? Is it now?
Yes, it is.
What does that look like right now?
So this episode, we're pre-recording, so it'll come out on May 4th. But Mental Health Awareness Week, if I'm not mistaken, is the second week in May. And when I say it's in the schools, it just depends on what school. Some schools make a big deal about it, and some of them just acknowledge it. So it just kind of depends on what school and what district you're in and what they believe.
When they acknowledge it, how does that look? I want to.
If they just acknowledge it, or
if they just kind of both ways. If they just acknowledge it, and I like to hear, if they have it as like a focus. How does that look?
I've seen it where they just acknowledged it, or the school that I was associated with, they had like a weekly show or whatever, and they'll put it in there. Hey, it's Mental Health Awareness Week. I've also seen where people pass out little pamphlets about stuff. I've seen on social media where somebody might have a big to-do when the kids come in during that particular week to address different stuff, SELs, social emotional learning. They have different aspects that they concentrate on, like self-awareness, decision-making, so on and so forth. So all of that would be kind of under the realm of mental health awareness that they may present at any given school.
Have you seen it as... Have you seen good outcomes maybe from that? Or have you seen it as... Do you feel as though it could be successful?
I can't speak to the outcomes from the school itself, but I feel like the kids of this generation, middle school, elementary, they are aware of depression, anxiety, these labels that we kind of thrown out here. They can say them. They have some idea of what it is, and they are articulate enough to say to somebody, "I need to talk to somebody." So I don't know.
So being that they're aware of the labels, do you feel like there would you like to see more? Maybe elaboration around those labels and around those mental health concepts in the school system?
I don't know. I don't know about that because.
Tell me how you feel about it.
The reason I say I don't know about that, because you can over-explain. To me, you can over-explain, especially when it comes down to mental health. Just a year or two ago, everybody was on narcissism, and this person is narcissistic. Everybody isn't narcissistic.
But that's what I'm saying, though. Like, those things are being perpetuated, like, on social media and whatnot. So
but the more you explain it, people are going to take what they take. So the masses is going to take what they take. So when you come into an individual setting, now I can kind of really over-explain and just really give you, all right, this is what it is, as opposed to me trying to come into a group setting, it's 25 students or it's 300 students. I'm explaining something, I don't know how they're receiving it. And then they don't always ask you. So I can only give you the basis and then hope that you come back to me for a clarification or go to somebody else for clarification. I don't want to further explain it.
Nah, I understand. Go.
No, you're fine. I just want to add that society as a whole, we have made a lot of progress when it comes to mental health. I'm still in my 20s, and I can remember just 10 years ago when I was in middle school and high school, we didn't have these conversations. We didn't have these mental health conversations. So, and then if we look back 10 or 15 years ago, before that, was mental health even a common topic to talk about in school? In the workforce. So in general, society has made so many progression towards normalizing mental health conversation. And I think there's still room for us to grow. There's still room for public schools and private schools to implement programs that really create positive change for students. And then not just in public schools, but in the workforce as well, in universities, in the library. There's space for these conversations, these mental health conversations to be had. But society, we have made a lot of progress.
We definitely made.
I love to see it too.
Definitely made progress, but I'm gonna say something we were talking about earlier offline. A lot of people talking about therapy, but they're not going to therapy. Mm-hmm. And then you got these people, social influencers. They throwing on that tag, mental health advocate. Mm-hmm. I don't know if they going to therapy or not, but sometimes I'm like, man. They talking and they pretty much repeating something they done said, they done heard from a psychotherapist or another therapist. But
social media.
Yep. But we got to go beyond that conversation and actually get to the process of going to therapy to address whatever individually we need to address, not what I just heard I might need to go over.
Yeah, and one thing that I do, every Monday I have Mental Health Mondays on my personal social media account. And this is just a way to normalize conversations around. Yeah, it's...
you got to give us your social media, too.
Yeah, most definitely I will at the end. But it's just a way to normalize mental health conversation. And I've had a lot of feedback. People say that I didn't even know, but I've had people come up to me and say, I use your post every Monday and I evaluate my relationships. I evaluate, my bonds that I have with people. I evaluate the way I communicate my feelings. So I think just normalizing these conversations, that's a start. But like Kervin was saying, we have to put in the work, the actions, and actually start going to therapy so that we can start creating change in our lives.
Most definitely. Anybody else got anything to add on top of this episode? I think some great things have been discussed and some great topics covered, some great advice given. But anybody got anything to add?
Man, you can really go a lot of ways with this. Unpopular opinions about therapy. We kind of need to have a part 2, part 3 on these because it's so much more that we ain't even discuss or talk about that people may or may not understand. But I guess we can just go ahead and end it here, Josh.
Well, I think the best question, I have one question. So I just want to evoke everyone in their own thoughts who are listening to this podcast. If you haven't went to therapy or are not currently utilizing therapy, ask yourself, why am I not going to therapy? Miss Hannah mentioned the workforce. A lot of jobs now offer EAP services, which allow individuals to utilize or access therapy at no cost to them. Generally, anywhere from about 3 to 6 or more sessions where they can go in and actually speak with a professional, either via telehealth for those who are comfortable experiencing therapy within their own homes, or referring them to other professionals where they may be able to sit down and have face-to-face conversation. And so the goal of this podcast is to make you think about that. And so I challenge us all to begin utilizing the resources that are available for us. It's hard to really get benefit from something that you're not taking advantage of, right? And just because you're not using it doesn't mean it doesn't work. And that's my end.
Yeah, I wanted to add one thing. You mentioned about the insurance and the billing piece, and also what I've seen, because I actually work at a mental health facility now in Charlotte, and what I've seen is individuals are able to use their HSA or FSA cards from work and use, which is just like a debit card that has prepaid money on it. They're able to use that voucher to apply to mental health services as well. So, we could always make excuses, but have you tried to find a solution to those excuses? And then I just wanted to add that therapy is not a last resort. Don't let therapy be the last resort. You've tried A, B, and C, and now you're exhausted, or now you're a ticking bomb, and now, you have to go to therapy. Don't let therapy be a last resort. Let it be something that you want to do.
Being at you, I guess, Hannah, we got one more question.
I'm a little scared about this one.
Winston shot it to me.
Before you go to that question, she said HSA. HSA is a health savings account, and you said one more. I can't remember the other.
Yeah, they're both the same.
Okay.
FSA, I'm not sure what it means, but
Okay.
they're both the same thing.
But those accounts, and she did say this, usually you can kind of put money into it every pay period, and then it covers it, so you don't have to use your insurance. Remember, we were talking about earlier the diagnosis. So you can use a health savings account. It's kind of like you paying out of pocket. But I just wanted to clarify that, because ultimately what we were trying to do is teach. So somebody might not know what HSA is. But go ahead, Josh. What question you got?
If you feel like your life is going well, should someone who feels like that still seek therapy?
I think she just kind of hit it. Don't wait till the last minute to. Don't wait till there's a problem per se. One of the things that I'm grateful for, that me and my wife went to couples counseling, and we didn't. There was no problems going on, or at least I should say, I didn't think any problems was going on. But when you go, you kind of see places that you can kind of bring yourself up on and do better, so that you don't get to the point of, one of y'all are tired of each other, or you're tired of yourself. So go before anything happens, and definitely if you see a change or you notice a change in yourself. But yeah, definitely go prior to that too.
So we can kind of help you identify some things.
I can agree. I would say that if you're not experiencing any problems in life, which is very uncommon because we all have some type of problems we're going through. However, if your life is pretty smooth, you know how to communicate well, I would say therapy is a tool to be proactive. Where can I grow? Your therapist, you're able to have those conversations of where are my areas of improvement, where I'm able to grow. What does the future look like? Not just trying to heal from the past, but what does your future look like? So therapy can definitely be a tool to just be proactive.
I love it. Well, it's been a great episode, y'all. I want to thank our guest, Ms. Hannah Williams.
Thank you all for having me. Hopefully I'm invited back.
Yeah, you're invited back. We're going to make sure of it. And want to wish you all the success in the world on your journey, in mental health and becoming a professional. That. Yeah, definitely love what you're doing. So we'll wrap this one up, y'all. Want to do a couple shout outs real quick. Let's start at the end.
How we get to you, Hannah?
Oh, yeah.
You're talking about
social media.
You have mental health Mondays or something?
Yes. So you all can follow me at on Instagram at Hannah Elise 2_. And then also I am a baker in Charlotte, so I'm gonna shout out my baking page, which is at Honey's Heavenly Sweets.
That's cool.
I do a lot with the help of God, but definitely follow me. I'm a mental health advocate, and then hopefully after graduation this year, I'll be able to just help our community heal.
I love it. Let's do some shout outs, Kirby.
Gravity Counseling Group. We provide individual, family, and couples counseling. We do a wellness group every month, and we want to be, or I want Gravity Counseling Group to be at the forefront of sharing mental health education, bringing awareness to the community here where I reside in Greenwood, but also South Carolina. If I can get nationwide, I'm gonna get nationwide too.
It's on the way.
But definitely want to bring mental health awareness wherever we go. So just follow us on those.
Miss D.
want to shout out my girl, of course, Taisha Williams, who is not present with us today,
Shout
but
out,
definitely
Ty.
in spirit. 61 Rentals for all your 360 booth needs. Check them out on all of your social media platforms. And I would be remiss if I did not mention Kodak Ready Consultant Services for all of your consultant needs, personal professional development, grief, goal clarification. Let us support.
Started by yours truly. Kodak Reddit. Started by yours truly.
Yeah, and check me out on YouTube. Let's talk about it. You can find us at Joshua Garvey Williams. We go around, we talk to random people. It might be you one day. We go around and we ask these really reflective and intuitive questions. Just want to create great dialogue. Want to get people thinking about things that we feel are definitely important, like the meaning of life, where you get your peace from. Things like
Happy
that.
Mental Health Month.
Yeah, definitely. Happy Mental Health Awareness Month. And we'll wrap this up, y'all. We'll see y'all again very soon. Hope y'all enjoyed this episode of Speaking with Gravity.